As coronavirus concerns continue to grow across the United States, more tests are being administered. Some are opting for a self-swab test, but how accurate are they? Western Mass News reporter Alyssa McCann is getting answers from a local physician assistant.
As COVID-19 tests continue to be administered across the country, some patients are opting to do a self-swab test.
The key thing is that you want to get a good sample, and to do that, you need to go way up into the nose, very close to the sinus cavity.
Louise Cardellina, a physician assistant at AFC Urgent Care, says right now there is not enough evidence to prove that a self-swab test is accurate, as doctors and scientists are still learning about COVID-19.
If there comes a point where if there's a backup at offices or there's a shortage of those tests and there's availability of the self-administered test, well then that would be an option.
But right now, there are enough tests in Massachusetts, so if you do need to get a test, Cardellina suggests seeing a healthcare provider.
The benefit of coming to an office, the people are trained to do it. They do it every day. The chance of false negative is much lower.
And even if you think it would feel uncomfortable, Cardellina tells Western Mass News a professional test is worth it.
My take on that is I'd be afraid of getting a false reading. So if you're gonna do it, make sure you do it right, and it's going to be if it's uncomfortable, you're doing it right.
Cardellina also says results can take a little bit of time, depending on where your sample is being sent, because self-tests are not the same as rapid tests.
Anyone else, say, traveling on a plane and needs proof of negativity, or traveling to Maine, where they're requiring proof of negativity, then those tests are sent out. And that goes to the lab, and then it depends on how backlogged the lab is.
Cardellina adds that there are currently less rapid tests available, so patients looking to get one need to qualify.
We do the rapid test for people who have symptoms or were in direct contact with a known COVID-19 patient, or if they're going in for surgery.
For Western Mass News, I'm Alyssa McCann.